Bloodborne pathogens. Infection control. Content. This course will focus on bloodborne pathogens and other potentially infectious materials, OPIM. Definitions, transmission, the law, occupations at risk, precautions, exposure controls, labeling. What are pathogens? Pathogens are infectious microorganisms that cause disease or illness in virtually any susceptible host. Pathogens can be transmitted to people in a number of ways. Airborne, e.g., chickenpox, influenza. Bloodborne, e.g., hepatitis, HIV. Foodborne, e.g., salmonellosis, E. coli. Vector-borne, e.g., malaria, Lyme disease. Physical contact, e.g., athlete's foot, impetigo. During pregnancy or delivery, e.g., STDs, herpes. What are bloodborne pathogens, BBP? BBP are infectious microorganisms infiltrated in human blood that can cause disease in someone who is exposed to the blood containing the microorganisms. Bloodborne diseases fall into 4 categories. Viruses, such as hepatitis B, HBV, and human immunodeficiency, HIV. Both can be fatal. Parasites, such as malaria. Bacteria, uncommon in people with normal immune function, such as Yersinia enterocolitica. Prions, such as Creutzfeldt-Jakob. What are OPIMs? Microorganisms present in other potentially infectious materials, OPIM, that can cause disease in people who are exposed to the fluids containing the pathogen. In addition to blood, OPIM include any body fluid that might be infected, including synovial, joint fluid, cerebrospinal fluid, vaginal secretions, saliva, peritoneal fluid, fluid that fills the abdominal cavity. How are BBP transmitted? Unbroken human skin forms a resistant barrier against BBP. However, infected blood and OPIMs can enter your system through open sores, skin cuts and abrasions, or the mucous membranes of eyes, nose, or mouth if you are splashed with contaminated fluid. Chain of transmission for BBP to cause a disease. Source, an infected person. Portal of exit, mouth, nose, cut, needle puncture. Route of transmission. Contact, blood, food, vector. Portal of entry. Mouth, nose, cut, needle puncture. Susceptible host. What is the law? The U.S. Occupational Safety and Health Administration, OSHA, Bloodborne Pathogen Standard 29 CFR 1910.1030 prescribes employer safeguards to protect workers against the health hazards caused by BBP and OPIMs. The standard regulates items such as exposure control plans, universal or standard precautions, methods of compliance, hepatitis B vaccination, hazard communication, training and record keeping. Does the BBP standard apply to me? OSHA's BBP standard applies to all employers, not just those in the healthcare industry, who have an employee with a reasonably anticipated chance of occupational exposure resulting from the performance of the employee's duties. The standard applies to both private employers and state and local governmental agencies. Is my occupation at risk? The BBP standard is not limited to employees in the following jobs, and employees in these jobs are not automatically covered unless they have a chance for occupational exposure. How do I prevent exposure? It is important for you to identify and recognize the ways exposure and transmission are most likely to occur in your employment situation. The use of standard precautions, along with body substance isolation, BSI, are required for OSHA compliance. Standard precautions includes the use of hand washing, personal protective equipment, e.g. gloves, gowns, masks, decontamination. What are exposure control plans? Employers are required to develop and make available an exposure control plan, ECP. The ECP is in place to protect employees from health hazards associated with BBP and provide appropriate treatment and counseling if an exposure incident occurs. ECP can be found along with most organizations' infection control manual. ECPs must include standard training requirements. The standard requires training at the educational level and in the language primarily used by the employees being trained. The training may be specific to different groups being trained, e.g., nurses, police officers. What infections can be transmitted through contact with BBP and OPIM? Some of the following infectious diseases are characterized by a phase in which the pathogen may circulate in the blood for a prolonged period. They are therefore capable of being transmitted through blood or OPIM. HIV, hepatitis A, B, C. Staph and strep infections. Gastroenteritis, salmonella, and shigella. Herpes, syphilis, malaria, measles, chickenpox. Urinary tract infections, and blood infections. The greatest risks for BBP are from HIV, HBV, and HCV. What is HIV? Human immunodeficiency, HIV, causes acquired immune deficiency syndrome, or AIDS. HIV attacks the body's immune system, weakening it so that it cannot fight other deadly diseases. Though a person has been infected with HIV, it may be many years before AIDS develops. AIDS is a fatal disease, and while treatment for it is improving, there is no known cure or vaccine. HIV is spread by sexual contact with an infected person, by sharing needles and/or syringes with someone who is infected, and, less commonly, through transfusions of infected blood or blood clotting factors. The chances of contracting HIV on the job is minimal. However, because it is such a devastating disease, all precautions must be taken to avoid exposure. What is hepatitis B? Hepatitis B is an infection of the liver due to the hepatitis B virus, HBV. HBV can be deadly, but is largely preventable. HBV can be transmitted by direct contact with the blood or fluids of someone who already has HBV. Blood transfusions, not common in the U.S., sexual contact, tattoo or acupuncture with unclean needles or instruments, shared needles during drug use, shared personal items such as toothbrushes, razors, to an infant during childbirth, direct contact in healthcare settings. HBV is not spread through food, water, or by casual contact. Is hepatitis B resilient? HBV can survive in blood materials for up to 7 days. HBV often is a chronic disease. Many people do not exhibit symptoms, while others never fully recover. HBV risk factors. Travel to regions with high infection rates of HBV, such as Africa, Central and Southeast Asia, and Eastern Europe. Being infected with HIV. Having multiple sex partners. Men having sex with men. Receive hemodialysis for end-stage kidney, renal disease. Hepatitis B data. 250,000 new cases a year and an additional 1.25 million cases of chronic infection. Hepatitis B is fatal in approximately 1% of cases. Hepatitis B vaccine. The vaccine offers immunity to infection. People who are at high risk, including healthcare workers and those who live with someone who has hepatitis B, should get the hepatitis B vaccine. All children should receive their first dose of the hepatitis B vaccine at birth and complete the series of 3 shots by age 6 months. Children younger than age 19 who have not been vaccinated should receive catch-up doses. What is hepatitis C? Hepatitis C is a serious infection of the liver caused by the hepatitis C virus, HCV. It can range in severity from a mild illness lasting a few weeks to a serious chronic illness, 70 to 80%. There is no vaccine for hepatitis C. Only discovered in 1989. About 3.9 million Americans have been infected with HCV, with 41,000 new infections per year. A growing epidemic like HIV, it is becoming more dangerous than HBV. How is hepatitis C spread? HCV can be transmitted by direct contact with the blood or fluids of someone who already has HCV. HCV risk factors: blood transfusions, dialysis, and organ transplants before 1992, improved blood screening tests available in 1992, shared needles when injecting drugs, getting tattoos from non-reputable sources, during childbirth from an infected mother, sexual contact, needle sticks or used needle exposures on the job. Is there a hepatitis C epidemic? Chronic hepatitis C is the most common chronic liver disease and causes 8,000 to 13,000 deaths each year among people with advanced cirrhosis and complications related to cirrhosis. One of the most feared complications of cirrhosis is the development of liver cancer, hepatocellular carcinoma. About 2% of people with cirrhosis, 1 in 50, develop hepatocellular carcinoma each year. Estimates are that over the next 20 years, the proportion of infected patients with cirrhosis will increase from 16 to 32%, and other complications will also increase dramatically, including hepatocellular carcinoma, up 81%, and liver-related deaths, up 180%. Other hepatitis C notes. Men appear able to sexually transmit to women. HCV responds to treatment about 30 to 40% of the time with ribavirin and alpha interferon. Highly correlated with ETOH, ethanol or alcohol abuse cirrhosis. Use standard precautions in body substance isolation, BSI, to prevent exposure to the virus. How to lower your risk of occupational exposure. Prevent exposure by the use of standard universal precautions. Wash your hands and wear your PPE. Empty needle boxes when they're 2/3 full. Do not recap needles or place used needles on surfaces. Infection control. Universal precautions and standard precautions. Infection control. Infection control program. The risk of developing a healthcare-associated infection, HAI, is minimized through an organization-wide infection control program. Infection risks will vary based on the facility's geographical location, community environment, the care, treatment, and services provided, the characteristics or behaviors of population served. The use of infection control limits exposure to pathogens throughout the hospital or facility, minimizes the risk of transmission of infections related to procedures, medical equipment, and medical devices. Infection control. What are universal precautions? Developed in 1985, guidelines designed to protect healthcare workers from becoming infected with HIV and other bloodborne infections, e.g., HCV, became known as Universal Precautions, UP. Because it is not possible to visibly recognize many people with bloodborne infections, UP had to be modified to include all persons, staff, patients, and visitors within healthcare facilities, regardless of whether or not they are infected. At approximately the same time that the diagnosis-driven UP were being initiated, a different type of precaution system was proposed, called Body Substance Isolation, BSI. What is body substance isolation? The BSI approach centered on protecting patients and healthcare workers from all moist and potentially infected body substances, not just blood. BSI was based mainly on the practice of using gloves. Personnel were trained to don clean gloves before touching body fluids or mucous membranes, and before likely contact with most body fluids. BSI also included protective immunizations of susceptible patients and staff for infectious diseases transmitted by airborne or droplet routes, tetanus, and hepatitis A or B, and revised instructions for people entering a patient's room or caring for patients with airborne infections. Body substance isolation continued. Healthcare workers accepted BSI better than UP because it was clear, easy to learn and use, and recognized that any patient, not just one with symptoms, might have a transmittable infection and therefore may be a risk to staff or other patients. Disadvantages of BSI included costs of protective barrier equipment and difficulty in maintaining routine use of the protocol for all patients. By 1994, many healthcare workers were completely confused as to what to do and when to use each precaution guideline. In other instances, some healthcare facilities were using UP, while others in similar procedures were using BSI. In other cases, when hospitals and staff thought they were using UP, they were really following BSI, and vice versa. A variety of uses was common. BSI and UP continued. In addition, there was often a lack of agreement regarding whether to do hand washes when gloves were used. Adding to the BSI confusion was determining what additional precautions to use to prevent diseases spread by airborne and droplet means. Based on the various problems and concerns, it was determined that a new system was needed to resolve them. CDC creates a new system. In 1996, the CDC created a new system to update the guidelines of UP and BSI. This system involves two levels: transmission-based precautions, which apply only to hospitalized patients, and standard precautions, which apply to all staff and patients within healthcare facilities. The new system retains the major features of both UP and BSI. What are standard precautions? The intent of SP are to prevent cross-contamination of pathogens. SP apply to all body fluids, including blood, secretions, and excretions, except sweat, non-intact skin, and mucous membranes. Any contaminated substances or articles must be handled in a way that protects the pathogens from spreading. Personal protective equipment, PPE, must be worn by all personnel, including gloves, gown, face shield or mask, and protective eyewear during procedures. Tissue specimens and all body fluids must be placed in a leak-proof container for moving out of procedure or operating rooms. CDC standard precautions. Key components: hand washing, or using antiseptic hand wash. Wash hands after touching any patient's blood, body fluids, or contaminated items. Wash as soon as gloves are removed. Wash between patient contact. Gloves. Avoid contact with body fluids and contaminated substances or articles. Avoid contact with non-intact skin and body membranes. Eye goggles, face shields, or masks. Protect eyes, nose, and mouth of personnel when contact with body fluids is likely. Standard precautions. Key components continued. Gowns. Shield skin from body fluid contact. Prevent contamination of clothing during procedures. Linen. Prevent touching skin or body fluids when handling unclean linens. Do not pre-rinse contaminated linens in patient care rooms or areas. Patient care equipment or devices. Handle contaminated equipment in a manner that prevents contact with skin or membranes and/or clothing or the environment. Disinfect and clean reusable equipment prior to reuse, according to manufacturer guidelines. Standard precautions. Key components continued. Environmental cleaning. Routinely disinfect all equipment and furnishings in patient areas. Sharps. Do not recap used needles. Do not detach used needles from disposable syringes. Do not bend or manipulate used needles. Always insert used sharps in puncture-resistant containers. Patient resuscitation. Avoid mouth-to-mouth resuscitation. Use resuscitation bags, mouthpieces, or other ventilation devices. Standard precautions. Key components continued. Patient placement. Place patients who cannot maintain applicable hygiene or contaminate the environment into private rooms. Patient documentation. All attempts should be made to keep patient charts, lab slips, X-ray reports, and other paper documentation from contamination. Standard precautions must be followed with all patients at all times, regardless of their diagnosis, disease, age, or gender. Standard precautions. Remember, don't wait for someone to protect you. Protect yourself.